So I'm right now, as mentioned before, in Malawi. I'm the on-site manager here for our project. And yeah, I'm also going to present about how we are there's still an urgent need in the world, and there are more than 2 billion people are lacking adequate access to essential medical supplies. And that's for blood, for vaccines, but also for other kind of medicines due to challenging terrain and gaps in the infrastructure. And this is also especially true when it comes to especially in the rainy season when the roads are impossible and cars can't reach to remote areas for weeks or even months. But also besides the rainy season, Malawi has quite a lag in the infrastructure still. And this is why our drones are helping in Malawi to deliver those medical commodities to the remote areas. And yeah, as mentioned already beforehand, I think you have seen already our technology, the 178, the previous copter, but now you can also see our new version, the 198. And yeah, Wingcopter is a German drone manufacturer, but also operator for unmanned aircraft systems which are flying autonomously beyond visual line of sight. And we are using these drones mostly for delivery purposes, for healthcare applications, but also for different kind of applications. And this is our new version, as mentioned already. And the payload for that version is like up to 5 kg, and we can cover a range from up to 110 kilometers. And with the newer the difference, or the big difference from that newer version to the previous version, is that this version is completely redundant. So there is no single point of failure anymore. So whenever, I don't know, the motor is failing, there's another motor which is then still working, so that the drone is really safe and reliable. And I can also give you a sneak peek in our production facility. So this is the facility which we are setting up in the past years in Germany, next to Frankfurt. And our production facilities are really set up for large scale production with cutting edge technology for aviation standards. And this will also help us in the long term to bring the costs for our production for the drones down. And as you can see, we have already quite a history in Malawi. We have done already several short-term projects or proof of concepts. The first of all, we have been flying at Lake Malawi from Nkata Bay to Likoma Island. This is the island you can see here, to deliver also medical commodities to the islands, because usually there's just like a boat going to the islands, and the boat takes the boat like several hours to go there, and via drone you can go there within half an hour. And the second project was within Kasungu district, where UNICEF established a drone corridor where different drone operators can come in and test their drones. And we did delivery flights there to 3 health facilities for the beginning. We had like 270 BBLOS flights covering a range from like 11,000 kilometers, and this was done within like 12 weeks of operations. And based on the successes we had with those previous proof of concepts, we are now currently within an 18-month project together with GSZ and UNICEF. It's called the Drone and Data Aid project. And within this project, we really aim to scale our operations, not just in the Kasungu district, which you have seen beforehand, but also in other districts. So we started again flying medical commodities in Kasungu to the health centers, and we added more health centers. So right now we are flying to 11 health centers within Kasungu, and we have set up also a drone hub in Mtiji district and also in Salima district, and we are right now onboarding the fourth district in the central region of Malawi. And yeah, as I mentioned, our long-term goal is to connect the whole central region of Malawi with drone delivery services, not only flying medical commodities, but also picking up lab samples and delivering vaccines and health products in the long run. And yeah, here you can see our team. So we have currently hired 7 high-skilled drone pilots from Malawi, and we are also looking for future positions like a flight operations manager, more drone pilots as well. We're also looking forward to hire a maintenance manager for our operations in Malawi, and also drone dispatchers. And how does our drone delivery service work? So usually the order is placed from the healthcare workers via WhatsApp to our Wingcopter team, to our pilots here in Malawi. And then the Wingcopter team, our pilots, they go to the district hospitals where the medicines are stored to pick up the medical commodities. And then they load the medicines in the drone. They communicate with the healthcare workers on site at the health centers. They inform them about when the delivery is going to happen, when they can expect the drone. And yeah, the healthcare workers on site at the other side at the health centers, we call them visual observer, and they are in constant contact over phone with our pilots when they see the drone coming in, and they make sure the landing area is clear, and then they can take out the cargo from the drone and put in lab samples or other medical commodities for the reverse logistic as well. And yeah, then the drone is flying back, and the delivery was successful. And yeah, here are some of the numbers, what we have currently achieved. I think this is now the numbers from until some weeks ago. So they have already changed slightly. But yeah, within the past, 40 months of operations, we have so far done more than 1,300 successful deliveries where we have carried medical commodities or lab samples or vaccines. Yeah, as I mentioned, we have 3 hubs right now fully operational in 3 districts, and we are flying to 24 hard-to-reach health centers. And the total amount of medicines which we have delivered or medical commodities is more than 1,500 kgs. Yeah, and we were flying more than 72,000 kilometers already within the past 40 months. And yeah, to also give you a sneak peek on what we are looking forward to achieve within the next year of our operations, we really want to connect the whole central region of Malawi. That's what you can see here on the map. So you can see where the Wingcopter is, where the Wingcopter sign is. This is Lilongwe, and we are planning to set up a centralized hub there in Lilongwe, in the capital of Malawi. And then from there, we want to add also the other districts. It's 9 districts in total where we want to establish drone hubs as well, so that then we can set up a drone network where our drones can be distributed from starting from Lilongwe, flying to each district wherever the biggest need is for the drones to deliver the medical commodities. And yeah, also we are looking forward to receive soon the new drone version, the 198. So we are currently still flying with the old version, the 178, but we expect 4 198s here in Malawi in country within the next month. And also beside our operations in Malawi, we had already also other projects within Africa. So we did a 6-month POC in Tanzania. We won also the Lake Kivu Challenge in Rwanda. We have a partnership established with the South African National Blood Service in South Africa. and more. And yeah, also beside what we have achieved already, we are really looking forward to scale up our operations within other countries of Africa as well, to help the local people there. And whenever we go somewhere and do operate our operations, we really want to make sure that we also create job opportunities for the locals, so that we equip them with the right skills. We hire local people from there and train them, onboard them on our technology. And beside that, we also are making sure that we are helping in reducing our carbon footprint, reducing CO2 emissions, because yeah, our drones are electrical drones, so they rely on battery. They don't need any fuel. And yeah, that's it from my side, and I'm looking forward for your questions. Thank you very much.